In Europe, the number of people who suffer from cardiovascular disease is alarming. Over 3 million people lose their lives after a heart attack each year. Nearly every second person is at risk. A person who has lived through a severe heart attack often does not recover fully. Chest pain, shortness of breath and fatigue can turn simple tasks in life into a struggle. Physicians have treated severe heart attack patients in various ways. For example, with medication, through bypass operations, and with procedures to keep the coronary arteries open. But these therapeutic methods do not appear to significantly improve the pumping capability of the heart muscle itself. The heart muscle remains weakened. At the Johann Wolfgang Goethe University in Germany, European scientists are now developing an innovative therapy to improve the pumping capability of injured hearts. They are investigating whether adult stem cells can stimulate the formation of new blood vessels in the damaged area of the heart. Stem cells are immature cells with the ability to differentiate into various cell types. Embryonic stem cells have the ability to develop into any of the more than 200 cell types of the human body. They can, for example, become cells of the heart, the liver, or the eye. Adult stem cells, as the name implies, are found in an adult body. Unlike stem cells found in embryos, adult stem cells cannot differentiate into all the cell types. The tissue from which the cells originate limits what the cells can become. Thus, the stem cells from the bone marrow can, for example, differentiate into red and white blood cells and into cells that are important for blood vessel formation.
Adult stem cells are interesting for all different degenerative diseases. That means where cells are destroyed or needs to be replaced.
For example, stem cells could reinstate blood flow into the leg of a mouse after the main artery supplying blood was cut. This could only be observed when adult stem cells were injected into the mouse. When no stem cells were injected, the blood flow did not recover. Studies such as these were prerequisite to therapeutical clinical studies with patients who suffered a severe heart attack. The aim is to find out whether the application of bone marrow stem cells taken from the patients themselves may improve blood circulation and ultimately the function of the damaged heart. After purification, the stem cells are reintroduced into the coronary arteries of the patient, the arteries that provide the heart with oxygen and nutrients.
The way these cells act on the human body is still not clear. However, we know that A. These cells are fully capable of contributing to the building of new vessels. B. That they can, at least in the test tube, differentiate into heart muscle cells. And C. That they release growth factors that may contribute to the self-regeneration of the heart.
The operation begins by inserting a catheter into the coronary artery of the patient. Then the stem cells are injected into the affected area of the heart, 3 milliliters at a time.
Now we're giving you the first portion of cells.
The procedure is carried out 3 times over a total period of about 18 minutes, and it is not without pain.
The ECG looks like a fresh heart attack because we're closing the vessel completely. It'll last about 20 seconds. Okay, now it's almost normal again. Now the pain is gone, hasn't it?
The results indicate that about 10% of the injected cells stay in the affected areas. The heart begins to recover, it pumps better, and the patient has increased strength and stamina. It appears that scientists may have found a new way for the body to help itself.